Assalamualaikum and a very good afternoon, ladies and gentlemen. Can you hear me?
Can, Iman, very clear.
Okay. Welcome to the Digital Health Webinar Series, Talk 1. So my name is Iman and I will be your Master of Ceremony for our today's event. Before we begin, let's take a moment to recite Al-Fatiha. May Allah make this event beneficial for all of us. Al-Fatiha. Amin Ya Rabbal Alameen. So before we begin our session for today, I would like to invite Associate Prof. Dr. Chew Boon Hao, our Head of Unit in Clinical Research Unit, to give his introductory speech. Welcome, Prof. Chew.
Okay, thank you. Thank you, Cik Iman. Cik Iman is a research officer in Clinical Research Unit, HBPM. So I'm the head of the unit. So we actually would like to thank you and welcome you all to this, actually the first series, first talk on Digital Health Research Initiative by CRU. If you ask me why are we doing this, I also can ask you why are you coming, right? Isn't it? So you feel like you need to come because you are doing something about digital health, or you feel like digital health is inevitable, is impending. All of us are exposed, are using digital health, and we know if you're in healthcare industry, we know everyone is doing it, and we know that we have to do more or we have to do it better. And we have this talk is actually the first step that we thought about with our colleague from Faculty of Science, Computer and Information Technology, or in Bahasa is Faculty Science, Computer dan Technology Maklumat. Yeah, just now we have Associate Professor Azlin from the Dean of the Faculty of Science, Computer with us. I'm not so sure whether he's still around. Just now I saw his name. So his and his faculty, we actually came together some weeks ago. So we discussed how we can do this, knowing that everyone is doing this, everyone is stuck somewhere, and we want to do something about this as well, planning for something inevitable. Yeah, you have a smartphone, you are using some apps, and if you have a clinic or hospitals, so you're using some electronic health records, isn't it? And now everyone were very aware of MySejahtera in the pandemics, telehealth, teleconsultation, all these things are becoming, faster and also becoming almost the norm in healthcare. And in UPM, in hospital, Hospital Pengajar, University Putra, Malaysia. So we are also thinking about something the same, but exactly how we can do it the best way, we are not so sure. And maybe some of you have more experience in this thing. Maybe you have published some articles or report, or you know someone who is resourceful and good and experienced in this thing. Please put in the chat box. Please share with us the link to your article, to your report, or give us contact of that person. We are doing something like, we want to gather peoples or Malaysians, or even if there are non-Malaysian here, to be in this group, so that to help us to see forward and to plan and to map out what is the best path in digital health research and transformations. And why is it we call this as Digital Health Research Initiative? Because we are from CRU and we believe before we do anything, perhaps do some research first. When I'm saying this, I'm saying something if something that's very common sense and obvious, then you do not need to do the research now. If you not very sure what is the best options or what is the best solution, then we always encourage, or even we are very adamant that you must plan and do research, collect scientific data before you want to decide what you want to do. So that's exactly why we call this a Digital Health Research Initiative, with the main aim of actually to promote, to encourage the best practices and the best adoptions and transformations and digitalization of healthcare. Yeah, so we have this to go on this journey together with our colleague from Faculty of Science, Computer and Information Technology. We hope together we can within UPM. We also would like to actually invite anyone in Malaysia. You feel like you can contribute or you want to learn together with us. We may actually officiating a this kind of groups together to learn and together to encourage research and to learn about new technology. You named it. Later Dr. Sam would actually share with us some of the very provoking and stimulating areas about digital health, about information technology, and and we know that this is not the last webinar or the last talk. Is a kind of a series to unfold and to actually to explore the scopes, and then we hope by this series with our colleagues from Faculty of Science and Computer and Information Technology, we'll be able to map, what's the best path should we want to transform or digitalize any parts of our healthcare, including your clinic, all that lah. Okay, so we know doing this, combining effort, collecting brains is the most logical and reasonable way uh, for a new uh, effort, for new hospitals or healthcare to think about their digitalization process. Yeah, so we hope to be encouraging this kind of collaborative combination of efforts, and leveraging on expertise of every one of us who are here, and also from your networking. And please share your knowledge, your contacts with us in the chat box. There will be somebody in the unit here who collect your chat, who collect your comments. Yeah, okay, so we hope also with this kind of combined effort, we will be able to come up with a clear map how we would go about it and what we should learn together. And at last, we will be able to conduct a good literature review and also making a good impact. And we hope all this uh, would return some fruits of all this effort over the coming years. Yeah, we don't know how soon and how long this will take, but I believe along the way and process, we would already learn something, and we hope also some review, some research could be conducted to better understand, and ultimately there will be a collective of knowledge that we can make it available, accessible to anyone, and of course to hospitals and to anyone at all actually who want to actually to able to see the best way forward in transforming and digitalization of healthcare. And we know the challenges. We know that technology changes so fast. And do you have a way to overcome this? Is affordability an issue here? And if it's so, how to overcome it? Yeah, and how effective, how efficient we can be. With the 5Gs coming, are we ready for it? All these many issues that we have in mind, and we hope that we don't continue to do the way we conduct research or we transform our healthcare. Don't do it in silos, and if we can have this kind of group, we'll try to maintain this group until we are having we get to the clear map, the best way to overcome all these things. So at this initial part, this early part, we may have a lot of things to cover, but we believe over coming years we will be able to tackle very specific digital or health technology issues. Certain new technology, then how to understand them, how to apply them, all that kind of issues lah. Yeah, so feel free to leave us your contact, or introduce us to whatever article or report that will be actually help this group to go forward. Right, okay, so I pass it back to Iman to introduce our speaker. And then later on, after that, we will open up again for discussion. Just stay with us.
Thank you, Prof. Chu, for the introductory speech. So for our agenda for today's event, I would like to welcome Dr. Yu Cheng Chen, which is also known as Dr. Sam, to give a talk on Introduction to Digital Health, the Benefits and Challenges. Just a brief introduction on Dr. Sam. He is a medical officer at CRU HBUPM, and he graduated from International Medical University in 2015 with a double degree. Due to his great interest in clinical research, Dr. Sam completed a Master of Science in Experimental Therapeutics at the University of Oxford in 2018, and his unending passion in research has rewarded him a second Master in Public Health at University Malaya in 2019. And subsequently, he embarked on a journey of Doctor of Philosophy in Public Health at University Putra Malaysia in 2019. So without further ado, let's welcome Dr. Sam. Dr. Sam, we cannot hear you.
Right. Okay, yes. Thank you very much for the very kind introduction. So I hope you can see my screen right now. Can you?
Yes.
Okay, cool. All right. So again, a very warm welcome, and thank you for joining us today this very lovely afternoon. So I'm Sam, and today I'm going to talk about a very interesting, a very exciting kind of topic, which is on digital health. And I realized our audience are actually from multiple disciplines, and you might have some experience dealing with digital health, or you might be quite at the infant stage at the moment, probably. But never mind, let's have some discussion, and then hopefully you can just enjoy and then find some good place to sit back, chill, probably have a kind of good coffee with you. And I hope you will enjoy this session in the next 1 hour. Okay, so, well, I think it is quite safe to say that our world is changing very fast, like what Prof. Chiu mentioned just now. And whether we like it or not, we want it or not, our world is changing, it's ever evolving. So one of the very apparent changes that we see is in the industry of automobile. So in the past 2 to 3 decades, right, we noticed that our grandfather's car, our father's car, their cars are very simple. They are very basic, and their only function is to bring you from point A to point B. Really, it's only for transportation purposes. But because the world is changing, there's a change in needs. There are more demands from our consumers, more demands on safety for the car, more luxury, more innovation, and more comfort, for example. So you notice that our cars are also getting more and more smarter. They are more, I mean, they are evolving. So if you happen to be a BMW driver, I hope you do. Obviously, I'm not. I wish I am. You will notice that in any BMW vehicle, there is a service called a concierge service. So what it does is, by the click of one button, you can actually access to a real operator who is a very nice lady, and you can ask her anything under the sun. You can ask her to give you navigation to somewhere. You can ask her where's the most beautiful or most good place for Korean food, and anything you can ask her, and then she'll reply you on the spot. So actually, there are some consumers who go and buy BMWs because of this service. And not just stop there. We don't stop here anyway. And just recently, if you notice, there are some electric vehicles. They are smart vehicles like Tesla. And like you see here, you have a big screen with AI functions. You don't even need to drive your car by your own per se. You can lift your hands off from the wheels. You know, you don't have to press the pedals, everything. The car can just drive you to your destination with the help of AI, with this technology. So technology is evolving. The world is changing, and so it's the same principle applies to our television. In the past 20 to 30 years, you see that our televisions are very chunky, very bulky, so heavy to carry, right? But nowadays, our TV is very smart. They are smart TVs. You can not only watch your television broadcast, you can watch your YouTubes, your Netflix, Spotify, you can download apps, play games, and whatsoever. So things are getting more smarter nowadays. Well, so we are quite safe to say that the only constant is change. And change is inevitable because due to the change in needs among the consumers. And the same principle applies to our healthcare as well. Because there's a needs of patient is changing, and we always, if you are in a clinician or you are working in healthcare discipline, you notice that there's always an unmet need of healthcare due to several reasons. So the first reason is because our population is aging, so people are getting older and older. So we need to focus on different things. For example, non-communicable diseases. And the second reason is because there's a rising cost of healthcare. I think we all can feel it. Our ringgit is getting smaller and smaller, and there's an inflation due to economic crisis, due to the pandemic, due to the Ukrainian war, and things like that. So our ringgit is smaller, and hence our expenditure in health is also increasing. And the third reason is because there's a worsening of income disparity, or there's an increase in child morbidity and mortality. There's the emerging of new pandemics like COVID-19. And just when we thought that COVID-19 is ending soon, right? Now we have this monkeypox coming up. So things are getting changing, and there are more and more infections disease coming in. And also the last reason is because there's a racial discrimination on access to healthcare. So knowing that we have a lot of unmet needs in healthcare, but our resources in healthcare is always in scarcity, is always limited. So how are we going to use these very limited resources to fulfill all these unmet needs? And one of the solutions, I'm not saying the only solution, one of the way is to digitalize our healthcare. Right. So now let's have some very short, very brief interactive session. So don't worry, you don't have to turn on your mic, your webcam. You just need to help me to go to this link here. I will send in the group chat. Just click open the link, and then there are 3 questions. You'll be greeted by 3 questions, and these 3 questions, there are no correct answers or there are no wrong answers. So basically, you just need to select. I just need to know your opinions. What do you know? How much knowledge do you have in digital health? So you may just go to this link here, and then just answer the 3 questions for me. So what you need to do is to enter your name anonymously, and then just fill in whatever opinion you have. And you can select more than one answer for all of the questions, right? Okay, I can see 13 participants is already in. So the first question is really about which of the following are considered as digital health technologies. And the second question is which of the following are the most significant benefits of using digital health technologies? You can select up to 5. And the third question is based on your opinion, please select the top 5 challenges encountered during the implementation of digital health in Malaysia. Okay, and there are 20 participants already. And I can see answers coming in. Thank you very much. Okay. And there are 4 more participants. Okay, all right, okay, let's move on. So for the first question, let's see how is the responses. Well, so most of us, 18% of us actually consider family planning apps as one of the technologies in digital health. And then none of us actually feels that computer at the nurse counter or endoscopic camera are considered as digital health technologies. All right, okay. We're going to talk about those in a while. And the next question, which of the following are the most significant benefits of using digital health technologies? Select up to 5. And then 18% feel that the most significant, the most prominent benefits is to make medicine more personalized for patients. That is true. That's very valid. And also increase the quality of life among our patients. That is true. And none of us actually feel that digital health actually ensures safety of healthcare worker. Is that so? We're going to talk about that in a while as well. And the third question, based on your opinion, please select the top 5 challenges encountered during the implementation of digital health in Malaysia. And 15% of us feel that cost is a major problem in the implementation, which is very true, yes, especially in Malaysia. We mentioned about the cost, we mentioned about the scarcity of resources in Ministry of Health. Yes, true. And the lack of data privacy, yes, that's true as well. And the lack of stable network stability. And none of us actually feel that fear of job replacement and increased unemployment is a great challenge in implementation of digital health. Is that really so? Okay, so let's get back to our presentation. Okay. Okay, all right, let's move on. So today we're going to talk about some introduction of digital health, and then followed by going through very briefly the timeline or the milestone of digital health. And followed by that, we will talk about some classification of digital health. And then we will talk about the 9 domains in digital health, and we will end with a summary. All right, so like what Prof. Chiu mentioned just now, yes, we at CRU actually initiated a project called Digital Health Research Initiative, and basically to improve the research in digital health. And under this initiative, we actually have this webinar series, and this is the first talk, and this will be all together, there will be 9 talks in total every 2 months. So what we try to aim for this webinar or this initiative is that we try to expose our clinicians or our healthcare professionals to digital health, to know more about that, to have more understanding regarding the benefits of it, regarding the challenges that we might face. And at the end, we will encourage our clinicians to conduct digital health research. All right, so we have been mentioning digital health for the past 5 to 10 minutes or so. So what does digital health really mean? It is very simple. It's basically the use of ICT or information and communications technology in medicine, not only to manage diseases, but also to promote wellness for disease prevention. All right, so if you ask ourselves, when does digital health actually started to be introduced? Actually, it is more than 30 years ago. If you can see here down below, as early as 1989, the first interactive telemedicine system, which is called Medphone, has been introduced in US. And of course, along the way, there are more and more advances going on. But remarkably, I just want to point out those important points, is that in 2007, there's a launch of first iPhone and the App Store by Apple. So before that, before 2007, a phone is just a phone. It's a way of communication, just sending SMSs and MMSs. However, in 2007, Apple actually introduced iPhone and App Store. So now, from that point onward, phone is no longer a phone. It can function as other devices, for example, medical devices. We're going to talk about that in a while as well. And in 2009, Google Flu Trends detected an outbreak of swine flu. And a year later, in 2010, the first digital health curriculum at medical school was introduced. And it was first introduced in a university called Semmelweis University. It's a very old Hungarian university, medical university, but they are very advanced in technology. And later on in 2016, the first AI-based medical algorithm approved by FDA. And this AI system is called Arteries. Well, nothing to do with blood vessels per se, but they are basically a system, an AI system used to analyze a lot of medical imagings, like mammograms, X-rays, CT scans, and all those. And then they help physicians to actually diagnose the disease accurately. So that's Arteries. It's the very first AI-based algorithm approved by FDA, and that was back in 2016. And Zeppelin delivers blood with drones in Rwanda. Rwanda is one of the countries in Africa. And I'm sure if you have been working in hospital, you know how long it takes to deliver, let's say, some blood products like platelets, right? So I remember there was some bad days when we require platelets so badly for one particular patient. And then because, you know, our Malaysians, we are so resourceful, everyone have a car, so we have traffic jam everywhere. So when our ambulance actually went to Pusat Darah Negara, the National Blood Bank, to get 4 units of platelets, it takes so long, few hours to reach our hospital. And of course, the patient actually is compromised. So these are the problems. So actually delivering blood products with drones might sound like a very promising idea, but of course with some caveats. And later on in 2017, FDA launches a digital health unit, and Microsoft announces the HoloLens for medical education. We're going to talk about HoloLens in a while. And in the same year, the first study proved that VR, which is a virtual reality, therapy eases chronic pain, especially back pain. We're going to talk about that later on in the talk. And the very first digital pill approved by the FDA called aripiprazole, which is an antipsychotic drug. And very remarkably, New Zealand is the first country to actually announce the digital health strategy. They are very frontier. And the first virtual clinical trial was completed in the same year in 2017. And later on, very importantly, in 2019, Apple actually launches their iWatch 4, which has the function of doing an ECG. And also the first mind-controlled exoskeleton allows paralyzed men to walk, and AI startup reports about COVID-19 before global agencies. And until recently, in 2020, the first approval by NHS Digital of a messaging app for use by both patients and the clinicians. And also the FDA approves the first AI-guided ultrasound device. So this is a very brief milestones that is achieved in the past 30 years. So we must know the past before we are moving forward, right? Okay, so if you are a parent and when you get back to home, and I'm sure this is something quite familiar to you, your kids are playing with a lot of toys and Legos, and then these Legos are actually scattered all around on the ground. It's very messy, of course. So what you can do is you will ask your kid to actually arrange all these messy toys and Legos accordingly into their boxes. And the same principle applies in digital healthcare, because just now when we answer the first question, we have a lot of examples of digital health technologies. They are everywhere, they are scattered. Sometimes they are ECG, sometimes they are CT scan, they are mobile apps, and so on. They are like everywhere. So we must find a way to characterize them into different groups according to functions. So why is it so important to classify digital health technologies into groups? It's because we want to bridge the communication between different stakeholders. So we as clinicians, when we want to communicate with the public, with our communities, or with some technology professionals, we need to use the same terminology. We need to make sure that we must make sure that our frequency is the same. We are talking about the same thing. And a classification is also very important to allow easier implementation of digital health. May it be for preventive purposes, for diagnostic, prognostic, or therapeutic purpose. And also we need a classification tool to define the boundary of digital health. And this is mainly for regulatory purposes. And to give you one example, our unit is actually doing a research on to create an app, a mobile app to improve health status. And these particular apps, obviously it is a digital health technology, but what does this app belongs to? Does it need to be regulated by law? Is it do we need to pass through some regulatory guidelines? So we need to understand where these mobile apps actually belongs to, how to classify digital health technologies. And last but not least, a classification allows easier characterization of benefits and risks of this technology to our patients. So if you ask ourselves, how do we actually classify them? Actually, there are 4 ways or 4 methodologies that people use to classify digital health technologies. And we have the WHO classification, we have the FDA, the Food and Drug Administration in the United States. We have the Frenchman classification method used in France, and also I'm sure if you are a clinician, you are quite familiar with NICE guideline in UK. All right, so WHO, they actually classify digital health technologies based on different stakeholders or users. So either it may be for the patients themselves, for the healthcare providers, for health system managers, and data services. And is it good enough? The short answer is no. Why? It's because, for example, virtual reality, VR, it can be used for many parties. It can be used for the patients themselves to relieve their symptoms. It can be used by healthcare professionals for training purposes, and so on and so forth. So this particular example of VR, it can belong to many different categories. And so there's no clear demarcation of these digital health technologies. So is it good enough? No. So next, we have this FDA method of classifying digital health technologies based on the types of technology used. So there are 9 major categories: health IT, we have mobile apps, wireless medical device, telemedicine, and so on. So are they good enough? Again, no, because they are not comprehensive enough. For instance, using back the same example, VR. So how can we classify them into any of these 9 categories? No. So actually we can't. So this classification per se is still not comprehensive enough, and we know that there are more and more technologies coming in. So the third classification is by the Frenchman, which they classify digital health technologies according to intended use. So they can either be classified into system services, general non-personalized user information, aid for living, prevention, screening, and so on. And the last is for autonomous decision management. So again, there's no clear demarcation of digital health technologies. And the last is the NICE guideline, which classifies digital health technology based on the potential impacts to users. And when we say impacts, right, it can be beneficial impacts or it can be harms. So they classify all kinds of digital health technologies into 3 major categories. It can be either in tier A, which include all technologies with potential system benefits, but no direct user benefits. Tier B is to include all those technologies that help users to understand healthy living and illnesses, but are unlikely to have measurable user outcomes. And for third tier, tier C, those include technologies for preventing, diagnosis, and managing diseases, and they are likely to have measurable user benefits. So again, these are very confusing. So at the end, we realized that out of the 4 methods of classifying digital health technologies, none of them are good enough and comprehensive enough. So what we did was we actually modified the FDA digital health classification, and we're gonna classify all these technologies under the sun into 9 domains, and we're gonna go through them one by one in the following slides. So for domain 1, I'm sure these are something that we are quite familiar with, especially if you have some experience in some IT hospital, some paperless hospital. So health information technology or health IT, they are hardware, it could be software, integrated technologies, or they can be some intellectual property that are designed to support healthcare or patients for the creation, maintenance, access, or exchange of health information. And health IT itself actually is a very broad umbrella term, below which we have electronic medical record or EMR, electronic health record EHR, health information exchange or HIE in short, and health databases or registries. So in the past few years, I've been working in Hospital Putrajaya, and we are basically using this system called Physician. And I'm sure if you are working in HPUPM, I think we are using THIS. All right, so just a little bit information on the progression of health IT in Malaysia. So EMR, or electronic medical record, was first introduced in Hospital Selayang about 20 years ago. And currently we have about a quarter of the government hospitals are using this system, the EMR system, as well as about 9% of the klinik kesihatan or health clinic in Malaysia are using this system as well. However, hospitals in Malaysia have been implementing EMR system operated by a single care providers within a particular facility. And what does it mean? Mean that if one patient comes to HPUPM, all his or her information will be collected and saved in our EMR system. But when this particular patient, he goes to Hospital Sedang, just across the road, and then his or her information cannot be shared to the Hospital Sedang because the system is only, all the information is only restricted within the facility. So there's no sharing per se. So that is really a problem. And MOH, they know the problem. So in 2008, the Ministry of Health introduced a health information exchange or HIE platform called MyHICS. I hope you have heard about this. And through the operation of MyHICS, a patient's discharge note is electronically transmitted between public hospitals only. And sadly, until now, only 9 public health facilities in Malaysia have this MyHICS. And one of it is HPJ, Hospital Putrajaya. And of course, the implementation has a lot of problems, which I'm going to share in a while. And it is a problem, really, because it does not include private hospitals. So knowing this problem, the Ministry of Health actually in 2016, with the collaboration with MIMOS, they introduced a Malaysian Health Data Warehouse, or MyHDW in short, which is basically a nationwide healthcare database covering all government hospitals and private healthcare facilities. So whether the patient go to public hospital, they go to university hospitals, or even military hospitals, they go to private medical center like Sunway and so on, or even GP clinics, we have access to their reports, to their information, and of course they have to have accounts in MyHDW. And this database is very good because they provide a real-time patient information system, because they update every 24 hours. So you really can capture the most updated information regarding one particular patient. All right, so it sounds very promising, yes, of course. And what is the benefit, or what are the benefits of health IT includes, they allow us easy access of information about patients at the point of care. And secondly, it helps us to share electronic information with our patient and with other clinicians, especially when we are referring patients from one hospital to another, for instance, from HPUPM to IJN. So they can actually share the information. And thirdly, it enables safer and more reliable prescribing by reducing medication error. And this is very true. I still remember when I was a very junior doctor back in Putrajaya Hospital, we don't know the doses, we don't know the correct frequency of a particular medication. So we always ordered it wrongly. So for example, when we ordered omeprazole, instead of 10 milligram, we put 1,000 milligram. So immediately that system, the physician will prompt up a pop-up screen saying that, hey, look up, you actually made a mistake. So please key in again, something like that. And those alerts actually avoid us making a medication error. And let's say for some antibiotics, right, instead of let's say it's a BD dosing, it's twice daily dosing, and we accidentally ordered 4 daily dosing. So this information, the inpatient pharmacists, they will be alerted by the system, and then these pharmacists, they will give you a ring, they will call you, and then obviously it's very annoying calls, especially if you are busy. But these are safe. This ensures the safety of a patient by reducing medication error. So actually, this is one of the benefits of health IT. And fourth, the health IT actually improve productivity and efficiency because you don't have to write everything manually with your hand. You can just type, and especially when you are in the operation theater, after some particular operation, right, you have to key in the procedures done, what is observed during the operation, things like that. So actually we have a lot of different procedures have different templates. So we just copy the template and then we just do some minor changing and then copy and paste, done. So it actually save a lot of time really in the operation theater. Otherwise, if you want to write it manually, it will take a lot of time. And last but not least, health IT actually help to reduce costs through decreased paperwork for sure and reduce duplication of testing. So yes, it sounds very promising, but what are the challenges that we might encounter when we try to implement the health IT in Malaysia? First of all, again, it's high cost of implementation. Yes, of course, it can save some time, save costs, but initially you will need a lot of capital to start a health IT system in your facility because it involves a lot of hardware, software, and implementation assistant. You need to hire staff and for IT staff, and then you need to give your staff, the hospital staff, your doctors, nurses, everyone trainings, and then there are ongoing network fees and maintenance. So these all will incur a lot of costs to the hospital budget. And secondly, the second challenge is really about staff resistance. And I'm going to talk more about this because I've been working in paperless hospital in the past 2 to 3 years. And then there are a lot of problems, although they are very convenient at times, but there are a lot of problems as well. And I remember during a ward round, because you round with your bosses, they want to do it very quickly because they are lacking of time. They want to do it quick. And usually when you try to save a particular patient notes, a progression notes for one patient, it takes 1 or 2 seconds, very fast, normally. But when there's an internet problem, when there's a downtime, it takes a lot of time for you to save one particular note for one patient. And imagine you have so many patients in the ward, and then your bosses are going around very quickly, and then you don't have time to save your notes. And then at the end up you miss all the plans, you miss all the investigation that needs to be done. So that's a problem. And then there's another problem regarding the hardware, the laptops, because we are the most young and most junior doctors. So obviously we are the one keying in all these patient notes by ourselves. So usually these laptops will be on trolleys, and then we will push these trolleys together with all those bosses during the ward round. And although we make sure that before the ward round we charge our PC, charge the laptops fully, but these laptops are very old. There are a lot of problems. So halfway through the ward rounds, and then the battery can die off suddenly. It's like pop, finish. So whatever you have key in is all gone, and then you do not manage to key in the management ordered by your bosses, and of course you'll be scolded. So we have tried to notify our IT department, but most of the time they will tell us that there's no peruntukan, there's no budget for that. So we are still using the same old laptops with the same old problems. So a lot of us actually quite reluctant to use the laptop, but there's no way that we can do another thing. So that's why there's another challenge of using health IT in your hospital. And the third challenge is about time consuming in training. Because of course, before you deploy the system, you need your staff to be trained enough. So a lot of clinicians, they don't have time to attend all these trainings or to adapt to this new technology. So it's time consuming. All right. And then of course, when we are using IT system, they are prone to data privacy. They're prone to cyber attacks. And then there are some concern about data privacy. And also data migration is a headache as well. I have some experience attached to UMMC just a few months, and I noticed that their system is very good. Their EMR is very good because, for example, patients that have a very long time follow-up at UMMC, at the 80s, in the 90s, all those are actually handwritten notes, right? Patient's note. They are not digitalized yet. So what UMC, the IT department did was they actually scan all these very old patient notes and then scan it in a PDF and attach the PDF files in their EMR. So if you go to the EMR for one particular patient, you can notice that there are a lot of PDFs consisting old notes. All right, so of course it's very good, but at the same time, it will take a lot of time. Imagine for one patient who have been followed up for 30 years, 40 years at the clinic, their medical notes is like so thick, it's like a dictionary. So the staff really have to take their time to scan one by one, sheet by sheet, and to transfer them to PDF and attach them to the EMR. So this will take a lot of time, and it's definitely a nightmare for them as well. And the other challenge is the limitation of technical resources, especially you are in a district hospital, your budget is very limited, and yeah, that will be quite difficult for you to adapt a health IT system in your facility. And the second domain is really about mobile apps or mobile medical applications. So why is it gaining more attention nowadays is because just recently in 2020, they are very close to 90% of the Malaysian population owning and using a smartphone. So our smartphone penetration rate is as high as 90%. So it's very high. And according to some reports, there were more than 90,000 mHealth apps in the market. And thanks to COVID, recently we have more than 350,000 digital health apps available in App Store and Play Store combined. All right. So why is the medical app so important in healthcare? First of all, they are very important for patient education and awareness. As what you can see here down below, this app is called Diabetes M. So basically, they have a lot of information about diabetes, how to manage, how to take care of your diet, how to exercise, how to monitor your blood glucose level, and things like that. And also for instance, WebMD Baby, this is an app for you to have, especially when you have a newborn at home. So how to get the baby to sleep, how to monitor their development milestone, how to look for jaundice, all these things are in these apps. So it's very helpful for new parents. And secondly, mHealth is important as a helpline. And I'm sure we all are very familiar with Dr. On Call, which is the largest apps in helpline apps in Malaysia, which consists of more than 1,005 specialists online available. So yeah, and then Doctor to Us, telling me all these apps actually provide consultations, counselings, and informations to the patients by using the mobile phone, right? So you don't have to go to hospital or clinic. And the third role of mHealth is really to diagnose and to support treatment. So for example, in this picture, you see this app is called Heartline, sorry. It's called Heartline. So you need to have an Apple iWatch 4. So this app actually, with the help of Apple iWatch, it can detect atrial fibrillation. And it has been validated. There are some articles published in JAMA Cardiology. So they are very useful, of course. And it can help you to detect atrial fibrillation and to prevent stroke eventually. And the fourth function of mHealth is to communicate and for training, especially for healthcare workers. So I'm sure we are very comfortable with MMA. We are very familiar with DocQuity, MIMS, CPG, Malaysia, MyNet. This is for antibiotics. So I realized that whenever you have doubts with the correct dosing or correct frequency of medication, right? Most of the time we will call the pharmacist inpatient. But I also noticed that when we call them, these pharmacists, they will also read from the apps. So if you want to save time, might as well you just go to the apps and read yourself. So it really saves a lot of time for you, especially you are quite junior and you are not familiar with all this dosing for this medication. And subsequently, mHealth also help for disease and epidemic outbreak tracking. I'm sure this is we are very comfortable with these MySejahtera apps. And last but not least, mHealth actually help us to collect data remotely. So we have RedCap, we have TeamScope, Open Data Kit, and so on. So if you are HP UPM staff and you need to use RedCap in your research, please come to CRU. We can give you further instruction on how to use it, how to register an account for RedCap, and you're good to go. So why mobile apps is so good is because it improves on clinical outcomes by allowing continuous health monitoring. So apps like MyFitnessPal, Apple Health, all these actually comes with features to monitor heart rate and blood pressure. So all this information, all these vital signs allow doctors to track the progress of diseases and track the effects of treatment on the patients remotely. And secondly, mHealth it's very useful to improve patients' health because apps are available to help patients being compliant to the medication. And for example, this app's called MediSafe Pill Minder. You can go and play with it. It's free of charge. You can download as free. And then basically, it reminds you to take medication. So example, if you want to take insulin at 10 a.m. in the morning or 8 a.m. in the morning, so they will have an alarm system. The alarm alerts you to take medication, to administer the insulin. And also there are some apps to track sleep and reminder for daily calorie intake. So all this actually improve your health as well. And mHealth is very helpful to reduce the cost of healthcare by enabling remote treatment, because all consultation, all dietary suggestions, all exercise regimens can be conducted, and those reports can be produced right away through your mobile apps. So it actually saves you some hassle to the hospital. You don't have to go to clinics as well. You can just do all these things at home. And effective prevention, disease surveillance, and quick response to disease outbreaks. All this can be seen in MySejahtera. And speaking of MySejahtera, people think that it's only about vaccination, only about scanning QR codes, right? Actually, it is not. Because if you go to your MySejahtera app right now, there are, in the front page, there are some constant updates regarding some health awareness. For instance, in the past few months, there have been posts about organ donation, early detection of cancer, and vaccination, things like that. So those actually are very good to improve awareness in health among our population. All right, so even though they are so good, but of course there will be some challenges that might be encountered when we try to implement that in Malaysia. So first of all, of course, it's about data security and privacy, because some apps require to enter your personal data, your name, your IC, your telephone number, your email addresses, and some even attached to your bank account if there are some in-app purchases. So all this actually raise concern regarding data security. And of course, speaking about network access, well, we have to admit that not all places in Malaysia have very good internet coverage. And I'm sure you have heard about this news that one Sarawakian girl actually climbed up the trees just to get internet access for her exams. So some places in Malaysia, they are not well covered, and the people in these rural areas, they are unable to enjoy all these benefits from mHealth. And of course, some people, they do not have education, or they do not have a lot of skills of using IT stuff. So the lack of education for technology and its adoption will lead to low uptake, especially among the elderly, right? So of course, owning a smartphone, we have about close to 90% of the Malaysian population, we own a smartphone. But owning a smartphone is one thing. Knowing how to use that is a different story. It's a different ball game. So they really need a lot of education. They really need time to be trained to use the mobile apps. All right. And last but not least is the policy and regulation challenges, because currently there's no specific legislative or regulatory framework in Malaysia that defines the term digital health. So currently in our country, digital healthcare products or medical devices, they are primarily governed by the Malaysian Medical Device Act 2012. Yeah, so with the lack of these regulation and policies, actually it prevents a lot of implementation of digital health. So the third domain is regarding wireless medical device, also something we are very familiar with. So basically, they are smart electronic devices that are worn close or on the surface of the skin. So yeah, if you look at this picture, it's very misleading, because we all thought that wireless medical device is equivalent to smartwatches, but actually they are not. In fact, under the term, under this wireless medical device, there are a lot of other devices. For instance, there will be smartwatches, head-mounted displays, smart jewelries, smart clothing, and epidermal electronics. And we are not going to talk about all these in this talk. Epidermal electronics, basically, they are like RFID stickers that you stick in your car, in your headlamp, so they can be stick on the skin, and then they can connect it via Wi-Fi, Bluetooth, and things like that to actually monitor some vital signs. So smartwatches is the most well-known wireless medical device to date. So we have iWatch here by Apple, we have Samsung Galaxy Sport by Samsung, and Xiaomi Mi Watch here. And of course, they are offered in different prices with different functionalities. All right. So what they do is they will collect users' health data such as heart rate, physical activity patterns, calories intake, how many steps you have walked, your blood pressure, your changes in mood, even whether you are stressful, and some of the apps for Apple they can also monitor the blood alcohol content. And in the event of medical conditions like heart attack, if you are using an Apple iWatch, good for you, because in the event of heart attack, they will send a signal to the nearest hospital. And of course, if you're using iWatch, you can download this app called Embrace, and then you can detect any seizures, basically generalized tonic-clonic seizure, and it will also send some signals to the nearest hospital. So why are they so good? Because they allow closer monitoring to patients' condition. And these wearable technologies, they are used to gather health data from patients remotely. So doctors, they no longer need to have their patients come to the clinic to collect all this data. And all this data lead to a better plans, treatment plans, and patient monitoring, obviously. And they are very easy to use because they are handy, they are small, they are smart, and they are quite comfortable to wear. And they look good as well. It looks very technology savvy by wearing that. So, and all those make them very user friendly. And also they are very valuable to elderly because like what I mentioned just now, smartwatches have medical alert system in the event of fall, in the event of heart attack detection. So all this can actually, when this thing happen, and they will send signals to the emergency services. So these are very good for our elderly, especially when they are alone. Nobody is going to monitor them at home. All right. And also they encourage fitness because when you wear all these smartwatches, it can track your fitness goal and encourage the community to exercise more and to provide healthy living as well. So they are very good, but what are the challenges that we may encounter when we try to implement this to our Malaysian patients? So first of all, it requires skills and knowledge because although wearables can perform ECG like we mentioned just now, it has been validated. It is they have very high sensitivity and specificity to detect myocardial infarction, for instance. But if they are not applied correctly, and then it may give you unsatisfactory result. And even if the patient can capture the ECG correctly, the results still need to be implemented by their physician. So they still need to come to the hospital. And data security concern is another big thing in using iWatch because you are using your own data, you're providing your personal data, and the capabilities are limited because all these watches, right, their functions mainly depends on the apps in the smartphone. So if you purchase an iWatch but you do not have an iPhone, those functions will be quite limited, unfortunately. And some of them can be quite expensive. It depends on the brands. The current available wearables can be relatively expensive and some apps need to be purchased. Even though you can download them for free, but then there are some in-app purchases as well. And as a result, the communities from the lower socioeconomic status, they are unable to enjoy all these benefits. All right, so the fourth domain, also something very familiar to us, is telemedicine. So basically, it is the practice of medicine using technology to deliver care at a distance. So it can be applied in multiple disciplines. First of all, it can be applied in emergency medicine. So you have teletriage, tele-MSE, EPPE. So imagine, I have experience of patients coming in the middle of the night, 3 a.m. in the morning actually. They came in because they complain that they have very high glucose level, but they have no symptoms for HSS, there's no symptoms for DKA and things like that. So in fact, this patient may not need to come to emergency department. They can just stay at home and then, to get some consultation online. So if we introduce this telemedicine thing, there will be a 24 hours doctor online, and then they can consult this patient. And maybe they can be directed to the nearest KK in the next morning. They need not to come to the ED department and to congest the patient over there. And yeah, so that's the application in emergency. And for nursing, this is mainly in Australia. They have this Google Glass breastfeeding. So basically, new mothers, they can actually consult a nurse, a lactation nurse online on the techniques on how to breastfeed their babies. And also in pharmacy, telepharmacy includes drug therapy monitoring, patient counseling to monitor the drug compliance and to dispense the medication remotely. And in the field of rehabilitation, telerehabilitation is used to deliver audiology tests, neuropsychology, speech language therapy, occupational therapy, and physical therapy for the patients. And remarkably, in cardiology, if you notice, I'm not sure if you have read this news in China, they actually have their 5G ambulance. So what these 5G ambulance do is that they will send the patient from home to hospital, obviously, but during the journey, they will do an ECG on board in the ambulance, and then they will using this 5G high-speed internet. They will send these ECGs in real time to the respective emergency department, so they can actually diagnose the disease before the patient actually reaches the emergency department. And actually, we are somewhere there in Malaysia. We have this project. It's a joint project between Yes, which is an internet provider, with First Ambulance. So they are testing this technology, and hopefully it will be available soon. And also in psychiatry, telepsychiatry is used to treat depression and PTSD. And also in surgery, telesurgery allows doctor to perform surgery on the patient at a distance. And this has been happening in China as well. Probably not so soon in Malaysia, but there are such technology elsewhere overseas. So what are the benefits of telemedicine? First of all, it improves access to healthcare because it can be delivered at a distance. So patient need not come to the hospital, especially for those who do not have transport, those who have lack of mobility, those who have not enough funding, or those who are quarantined at home due to disease outbreak, or those from rural areas. So these patients can actually access to healthcare at a distance from hospital. It can save you some hassles, in terms of transportation to the hospital. And higher patient engagement rates, because online consultation, appointment booking, and reminders help patients to be more engaged, to be more involved in their care. And this also reduces the risk of exposure and anxiety to visit to a clinic or hospital as well. And also the third benefit is about better patient outcomes, because closer monitoring for diabetes, high blood pressure, heart disease, MSK problems, behavioral problems produce better health outcomes. And also it reduces hospital burden, because telemedicine may help to solve increasing shortage of healthcare professionals and to reduce hospital visits. So it actually eases the congestion in the hospital. And also it will help to cut the cost for patient and healthcare facilities. Yep. So what are the challenges that we may encounter when we try to implement telemedicine in our facilities? So first of all, the most possible one is the lack of acceptance among healthcare providers, either because they have a lack of desire or unwilling to adapt to clinical paradigms for telemedicine applications. And in US, reimbursement is a problem in using telemedicine, because Medicaid and Medicare, they actually did not reimburse the use of telemedicine at the same level as a traditional on-site visits. So if you want to claim for insurance, if you spend the money that you spend in telemedicine, actually you cannot claim in your insurance from your insurance company. And also when you're using telemedicine, another concern is about security measures, because you are using Zoom and Google and something. So all these can actually cause some problems in terms of security. All right. And also lack of awareness. If patients they are unaware of the telemedicine option, they will never request for it. And again, lack of IT literacy is a problem here. It's a great challenge in our country because patients may not have the technology required to make efficient use of telemedicine, especially the elderly. They have the laptops, but they just do not know how to turn on their webcam to use Zoom or whatsoever, right? So that's for telemedicine. And in domain 5, very interesting one, we have artificial intelligence or AI and machine learning. So actually in our daily lives, right, we are using AI and ML every day without knowing that we are actually using AI. Well, one such good example is YouTube. You will notice that whatever you watch previously, and then there, in YouTube, there's this function called Up Next. So the next video that they show to you will be quite relevant to the previous videos that you watched before. Why? Because they use AI technology or algorithms to detect your watch history, your search history, and from that they will know what is your interest. So they will blast you with all kind of similar kind of videos. Next. So also when you email, there's some they can predict what you want to type. There's for Gmail, and I'm sure in your mobile phone as well, there's this function to predict what you want to type. And one such example of AI in our daily life is the use of Siri, where you can ask Siri anything and the Siri will provide you answers. And also Cam Scanner is another example. And let's say if you listen to some very nice song, but you don't know the name of the song, so you can actually use this app called Shazam to detect the song, and then the apps can actually tell you what's the name of the song. They can even give you a link to that song on YouTube. They can give you lyrics and whatsoever. Why they can do this is because they are using AI and ML. They have a very large libraries of songs in their database, and then when they detect a certain part of the song, then they straight away can know what's that song. So that's using AI. All right, so that's for non-medical applications. How about in medicine? And for that, let us know what is AI really is. So AI basically it is a simulation of human intelligence in machines that are programmed to think like human and to mimic their actions. So mainly AI is a very big umbrella term, and below which there are 6 major branches of AI. So they are machine learning, and machine learning itself can be classified, it can be divided to supervised ML, unsupervised ML, and so on. And the next branch of AI is neural network or deep learning. There's NLP, natural language processing, fuzzy logic, expert systems, and robotics. And we are not going to talk about this in detail today, probably in the next lecture or next talk. All right. So the applications of AI in healthcare can be seen in various ways. So I'm sure we know what chatbots are. So basically you are chatting, but that person is not a real person, it's a robot. That's why it's called a chatbot. So a chatbot offers immediate conversational responses for patients, and it helps provide primary care and triage for 24/7. And they also help patients to save costs on avoiding trips to the medical practitioner. And one such example is the One NUHS chatbot shown down here. So basically, let's say if you have problem with your cholesterol, and then you can, anytime you can just type in the chat here, you say, hey, I got a problem with cholesterol. My cholesterol result is high. What should I do? And then the chatbot, the robot or the AI will immediately respond to you. I'm not sure whether you can read this. They say high cholesterol usually indicates a higher risk of heart disease, but don't worry, it is reversible. And you can try to reduce your cholesterol by cutting down some fried food and fatty foods of meat and so on. So they can actually provide you immediate response. It's like you're chatting with a real person, just that they are not real person, they are robots. And the second application of AI in healthcare is about robotic surgery. It helps to minimize case-to-case variations, improve the efficiency of surgeons, It mitigates the probability of shudders or any accidental movement during surgery, and also they can execute very precise cutting and stitching. And one such example of using a robotic surgery is seen in this university called Maastricht University in Netherlands. They actually have this system called AI-assisted robotics called MicroSure, which is used to suture a very narrow blood vessels up to 0.03 to 0.08 millimeter, very fine blood vessels in a patient with lymphedema. So these are the example of using robotic surgery with AI. And also we have something called virtual nursing assistants. They are like nurse, but they are AI. So this enable regular and consistent communication between healthcare providers and patients. They interact with patients to monitor symptoms and offer quick answers in real time as well. But they are more than the chatbots. They provide reminders for health checkups, diet requirements, and medicine reminders. And also they can help to schedule doctor appointments and monitoring their health status. And one such example is Care Angel. Of course, it comes with some fees. It's available in US. And also AI can be used in conducting clinical trials. Because AI streamlines drug development by going through millions of data points to assess the feasibility of drugs without risking the lives of human participants. And AI machine can also monitor the different effects of drug on participants and gather the data to provide valuable insights into the process. In a short word, it saves you some cost, it saves you time, and it improves the safety among the study participants. And in disease diagnosis, AI system actually help to analyze patients' past medical records and combine it with their medical images to provide accurate diagnosis. And one such example, AI can enable the early detection of breast cancer, skin cancer, and diabetic retinopathy. For example, you can use there are some Google developed something called Google Health. So this system, what it does is they have a library, they have a very huge database of images, of fundus camera images, and then we know that diabetic retinopathy they have several stages, all right, and these stages is determined by the fundus camera, the features in the eye. So with these many fundus images in their database, this system actually is trained. They are taught how to differentiate different types or different stage of diabetic retinopathy. So when they are trained enough, and when you give an image of fundus camera of one patient to that system, the algorithm can analyze the image, and straight away it can tell you this patient belongs to which state of diabetic retinopathy. And there's only one example for retinopathy. The same principle goes to breast cancer. So by giving one mammogram images, by looking at the lesion, they straight away can tell from their database what is this lesion. Is it malignant or is it benign, right? And last but not least, AI can actually help to improve administrative workflow, because technology like voice-to-text transcriptions help clinicians to automate non-patient care activities such as ordering tests, prescribing medication, and writing chart notes. So clinicians no longer need to write their notes, but they can just speak it verbally, and then the system can actually convert those voice into text. Right. So what are the benefits of AI and ML? First of all, they provide better data-driven decisions. They increase disease diagnosis efficiency, like we mentioned just now, how they assist clinicians to diagnose diabetic retinopathy, breast cancer, and skin cancer. They reduce the time required for treatment. They can help to create time-saving administrative duties, and hence the doctors have more time for patient care. And they also integrate the information. They reduce unnecessary hospital or clinic visits. They offer better patient care and reduce costs. And of course, even though it sounds very promising to our healthcare, of course, it will come with some cons, some challenges during their implementation. So first of all, they might have some reluctance among medical professionals to adopt AI, especially those very senior medical staff, right? And also integration of data is complex, which can result in missing and disparate data. Challenges such as trust issues among patients, because now you are not, your disease is not diagnosed by a real person by a trained doctor, but now your disease is diagnosed by an AI machine. So there might be some trust issue among our patients, especially in Malaysia, where we are more conservative. And also talent shortage is an issue because AI requires specific skills and knowledge. And then maybe there are some fear of job replacement and increased unemployment as well, because they are concerned that computers will replace physicians and medical staff. But at the moment, we are still not there yet. There's still no possibility that AI can replace us as medical professionals, but in fact, they will just assist us to better diagnose, to better manage our patient. So don't worry. So no worries about that. And also there will be less human interaction and affectionate care. Concern regarding data privacy is another big concern. And difficulty in learning a new technology in the workplace, that's also very true. It's very real struggle. High initial capital requirement is especially true for Ministry of Health, and the lack of curated healthcare data because lack of database for learning. All right, so that's about AI and ML. We're going to talk about AI in the next 2 months. We have our next talk will be in 2 months' time. So we're going to talk about that in great detail later on. So the sixth domain is about a software as a medical device. So basically, what is that? So software as a medical device, or SAMD in short, it is standalone, is an independent software intended to be used in medical purposes that function without being part of a hardware medical device. So what it means that it does not require any other medical device to function, right? However, it may require non-medical devices like a tablet, like a smartphone, like a computer, in order to run correctly. And one such example that we are quite familiar with is the Framingham risk score to diagnose coronary heart disease. This thing you can type in Google. You can type Framingham risk score, and then it will lead you to this software. So what it does is that we can put all this information like patient's age, patient's sex, smoking, cholesterol level, and things like that. And by one click, you can know the risk of patients developing coronary heart disease in 10 years' time. So this is a good example of software as a medical device. It does not rely, their function do not rely on other medical device, and they can function as a standalone device. And some other examples like UKPDS, Q-Kidney Engine, those are for to predict the risk of developing chronic kidney disease in 5 years' time. So those are examples for software as a medical device. And applications of SAMD, it can be used to screen and to diagnose. So there's a software called CardioFlux available in US. It has been approved by FDA. So what it does is that it will evaluate the electromagnetic activity of the heart to diagnose coronary artery disease. So if you read the paper, right, they claim themselves to be more effective than a normal resting ECG to diagnose CAD. So yeah, basically they use the principle of electromagnetic activity to detect the possibility of of CAD in an emergency department, and this can be done within 10 minutes, 5 to 10 minutes. So it's very efficient and very accurate, they claimed. And also SAMD can be used to monitor and for alerting. For example, Propeller Health uses Bluetooth on patients' inhaler, which is an inhaler with a Bluetooth technology, to track the triggers and symptoms of patients with asthma and COPD. And also for chronic disease management, like Lilly's GoDose, it's basically it's a software to help clinicians to manage diabetes, because especially when you are a very junior doctor in the clinic, you do not know, or you are not confident enough to manage to change the insulin dose, right? How many units you want to dose up, how many units you want to reduce. You're not confident enough. So you can use this software to actually guide you to adjust the insulin dosage for your patient, all right, based on their meals and blood glucose level. And also SAMD helps for digital therapeutics. There's a software called Reset. It delivers a 12-week cognitive behavior therapy to help patients who suffer from substance use disorder. So this is basically in psychiatry. All right, so why is it so good? It's because it can improve health outcomes. And also it's very cost effective because it's just a software. It doesn't require any hardware. But what are the challenges that we might face when we try to adapt it in our clinical practice? First of all, it is difficult to integrate and adapt. Difficult to integrate and SAMD is hard to adapt to ever-evolving technology. So we know that our technology is changing very fast. So this software might not be compatible to the latest technology because they are updating it very soon, very frequently. And also when you're using a software, security is another concern. So it might be prone to cyber attack, attack who remotely take control of the device, change functionality, and to affect the safety and effectiveness of the device. And also there's a possibility of leaking of confidential information. So that's another concern of using SAMD. So the domain 7 is about medical device data system. Yeah, so basically they are hardware or software intended to transfer, store, to convert formats and display medical device data. It does not modify the data, but and it does not by itself control the functions of another medical device. It sounds very lengthy, it sounds very confusing, but actually they are very simple. So basically, you have a bedside medical device, for example, this cardiac monitor, and then this MDDS or medical device data system that act like a bridge to convey the message, to convey all this data into your computer system. So if you have been working in ICU, you notice that you can actually monitor your patient's vital signs, for instance, at the nursing counter. So you don't have to go to your patients one by one in the ICU, but you can monitor all of them through your PC. So this is one good example of MDDS. So it is very good because it's versatile. It supports a long list of medical devices. You can connect to it can be connected to mechanical ventilator. This system can be connected to cardiac monitor and many other devices to your computer. So it's very versatile. And they reduce the data entry errors because if you want to copy the whatever data and then you want to transfer them into your EMR, it takes some time and it is prone to errors due to human errors. But if you have this system, they can fed all this information from these medical devices at the bedside to your PC immediately by just pushing one button. So it's very good to reduce data errors. And also it improves productivity and save time. So of course, all these benefits come with a cost because they are quite expensive, because the cost of developing and maintaining MDDS is a major concern, and you need an extensive expertise to make this system during the development. So it comes with a cost, of course. And when you use software, it's also prone for data privacy concern. All right, so domain number 8, the second last domain, it's about virtual reality or VR. So VR uses a head-mounted display, smart glasses, or haptic gloves to generate realistic images, sounds, or other sensations that stimulate the user's physical presence in a virtual environment. All right, so I'm sure you have seen about this technology. So how can they help in healthcare? For instance, in the rehabilitation of stroke patients, VR technology can create a 3D environment to help them to retrain their motor movements. And in psychiatry, there's something called a virtual reality exposure therapy, or VRET, which is a form of exposure therapy to help to treat the anxiety disorder, PTSD, and phobias. And among Alzheimer's diseases, these patients, they can make use of this VR technology to simulate real experience that would not otherwise be able to experience due to their current state. And it's also not only beneficial to patients themselves, but also among healthcare professionals like us. In terms of medical education, Johnson & Johnson Institute actually launched a global VR training program, which is designed to teach surgeons, nurses, medical students how to perform medical procedures like suturing and some surgical skills. And also it helps to, just now in the very first few slides, we talked about how VR helps to relieve chronic pain. So we have this VR system called Relief VRX and Applied VR. These systems use strategies like mindfulness, meditation, and some guided imagery or cognitive behavior therapy to reduce chronic back pain. And those are evidence-based. They have published some articles regarding this. All right. So they are very beneficial to healthcare in Malaysia because they can be used remotely. Training for medical staff can be done off-site, for instance. They are easy to use. You just put it over your head, over your eyes. You are good to go. And they can be used to collect data as well, especially when you can use that to measure the movements of rehabilitating patients or the accuracy of motor skills of surgeons in training. So they can collect data as well. And they can be also used for training, like we mentioned just now. So what are the challenges that we might face when we introduce VR to our patients or to our medical fraternity? So first of all, they reduce face-to-face communications because it's virtual. So the use of VR to perform rehabilitation exercise at home without the direct supervision of professionals could lead to undesirable outcomes. And secondly, is the cost. Yes, although the device is quite cheap, it's not expensive, but establishing and developing VR programs for your hospital requires high quality hardware, and it requires a lot of high speed computers, graphic cards, tracking system, high resolution displays, and highly specialized accessories. So all those will incur some cost to your healthcare facility as well. And another thing is again about reluctance among the healthcare professionals who are unfamiliar with IT, and they will resist the use of new technologies, especially the more elder or more senior medical staff. And our parents always, when we are small, right, our parents always tell us not to play with our phones too long, too much, because staring at the phone is bad. It hurts your eyes, right? So imagine you are putting a VR device over your eyes. It will actually cause some side effects, especially for cyber sickness, perpetual motor after effects, headaches, eye strain, and addiction. All these have been reported to be potential side effects after prolonged use of VR devices. All right, so the last domain is about augmented reality. So how is AR different from VR? So augmented reality or AR, it is defined as an interactive experience of a real-world environment. This is the key word, where the objects that reside in the real world are enhanced by computer-generated perceptual information. So AR different from VR in the sense that it alters one's ongoing perception of the real-world environment, whereas VR completely they replace the user's real world. So meaning that AR actually enhance your experience in the real world. You are still in the real environment, but VR create a 3D, a virtual environment for you. So you are not interacting with the real environment, but you are interacting within a virtual environment. So how can AR actually help in healthcare? So in terms of venipuncture, which is basically to insert a needle or a cannula to your blood vessel, what you can see here in the picture here, Vein Finder with AR technology can film subcutaneous veins and projects the architecture of the veins onto the skin. So especially if you're quite fat or when your veins are, it's not obvious, so it's actually very hard to insert a cannula to you. So by using this technology, they can actually project the architecture or the anatomy of your veins over the skin, and you know exactly the location of the vein, and you can insert your needle or cannula easily. So that's one example of augmented reality in healthcare. And also in surgery, just now we mentioned about Microsoft HoloLens earlier on in our earlier slides. It helps surgeons to identify blood vessels by displaying them in the 3D virtual image. As you can see here in the picture at the bottom, that actually displays the entire anatomy of the blood vessels, all right, during a surgery. And the surgeon can actually interact in the real world by using this technology. And also, AR can be used for training for invasive procedures. For instance, AR can be used to provide guidance in simulating ultrasound-guided needle placement. All right, so they are very useful because they enhance the learning experience in medical training, and they increase accuracy and efficiency for surgery and medical procedures. And there are challenges during the implementation. They are quite similar to VR. All right. So in short, we know that from this particular talk, we are reminded that healthcare is no longer limited to physician's office, right? It's no longer limited or constrained to a clinic, to a hospital. It can be delivered anywhere in the world. And healthcare is changing from a state of patients being dependent on clinician for isolated care to patient taking charge of their own health, and they can make informed decision in a continuous care by using digital health. And each of the 9 domains of the digital health has its own benefits and challenges, and these challenges need to be overcome. And further research in digital health is warranted because obviously you have to look in your clinical practice in your own department, what is the gap in literatures. And also, even though there are a lot of papers, a lot of articles published elsewhere in US and UK, but those technology has not been validated in the local context. So perhaps the next thing to do is to validate these technologies in our Malaysian population. And last but not least is to focus on one area and start by doing a review. And if you have attended our previous talk during the International Clinical Trial Day, there, I think Prof. Adiba actually, she shared in a forum telling us or encouraging us to be focused in our practice. Of course, if we are a clinician, we need to treat everyone. We have to look after every kind of diseases. But in terms as a researcher, we need to focus on one area only. So for example, if you are a psychiatrist, you need to see all sort of psychiatric disorder in your clinics. But if you are to do research, you as a researcher, you can focus on one disease, for example, depression. So you focus on one disease and to see how this digital health can actually improve your clinical practice. All right, so you need to focus on one area, and perhaps the first thing to do is to start by doing a review. All right, so in a nutshell, hopefully digital health technologies help us to increase the quality of care, to improve the quality of life among our patients, and to improve to allow earlier intervention and to promote self-care. And with that, hopefully with the help of digital health technologies, you can reduce hospital admissions, reduce hospital stays, reduce emergency visits, and also we can reduce hospital charges to our patients as well. So last but not least, please allow me to make some announcement. So today we are talking about introduction of digital health and their benefits and challenges. So next, just now we mentioned about the digital health webinar series. So it consists of nine talks altogether, and it will be delivered by different speakers. So in August, which is 2 months to go, we have a very interesting topic about AI and ML in healthcare. And hopefully we can invite some experts and then we can talk about it in detail. And I hope you enjoy the talk, and I hope you have a nice day. So we shall pass the time back to our to Iman. Yeah.
Thank you, Dr. Sam, for your presentation. So before we end our session, I will pass this session to Prof. Chu to moderate the Q&A session. Sorry.
Okay. No, there's no Q&A actually. Never mind. Thank you, Iman. And thank you very much, and congratulations, Dr. Sam, for very, very extensive sharing on digital health, what it can do to us, and how we can really go about it. But still, you can find that it is very extensive and very wide in scopes, and there are many multiple possible technologies out there to use, isn't it? And if I pose these questions, then you may start thinking, if you want to start digitalize your healthcare, which one to go first? And is it okay if I keep doing one thing at a time? It's because it sounds more feasible, isn't it? And then where would that get me to? And how much do I want to achieve at the end? Would that be the most efficient way? Or do I have to have a map, a whole like blueprint? But am I affordable to achieve what I want to achieve? And do I have to sacrifice or miss something, or have to revise or upgrade some hardware because the new hardware has come out or the new system has come out. So how is the best way to go about it? When I ask this, it's actually we are asking this is kind of hovering, haunting us as what's the best way to go about it. If we don't ask these questions, then likely that we are going to do just what we can do, or likely that we are just going to do what actually come to our way, isn't it? And we have many friends, we have many colleagues, isn't it? You found that they have done something, and you may actually have done something, but you found that you are stuck somewhere, and you don't know how to progress or how to proceed, or you may have not been able to achieve what you want to achieve. So we would like to hear your experience or even your advice if we want to start doing something about digitalizations of our healthcare. How should we go about it? And what is your experience? If you can share with us. If you are shy, you may actually put it in the chat box, or you have actually published anything, again, you put in the chat box. We would have collect it, and we would try to, as we progress, we will try to refine and to make things clearer. So as we go from June to October next year, we hope to actually to come up with a clear map and knowing what are the challenges or what could be the pitfall that, or what would be the best affordable, efficient way to go about it. And we recognize that the first thing that we are likely to do is to conduct some research, isn't it? To identify unmet needs among the hospital clients or clinical clients. And it may also need necessary to survey our own staff to find out what is the most headache operation issues in the hospital, at the clinic, at the pharmacies, isn't it? So all this could be done, and we are actually collecting colleagues and compatriots, also inviting experienced people to share with us your experience. Is there any? We would also actually would want we would have a link for those of you who want to stay with us. I mean, on this journey, as I said earlier, so we will get you informed. And if you also have any resources, so you may just share in a kind of a WhatsApp group, that kind of thing. Is that okay? Okay. All right. Thank you. Is there anyone here would like to say something? Okay. Thank you for all the okays. Is there anyone who has experience in digitalization of your healthcare? Maybe at your personal clinic, or if you are from a big institutions, any policy that you come across, or let me see who is in the audience, if I know anyone. Hayati and Hafiz is our IT guys in the hospital, right? So Hayati and Hafiz, do you have any insights after listening to Dr. Sam's talk? There's another challenge, isn't it? If you want to have the apps, right? So I personally have come across, encountered the issues of server. We need to have a good spec and capacity of server to actually, to host our apps and all that, isn't it? Puan Hayati, Encik Hafiz, you want to share anything? So one from Dr. Farida. HPPM or UPM has a clear policy on the digital health. Not that I'm aware of. Do we have that? Puan Hayati or Encik Hafiz? Ada clear policy ke?
I can respond is the policy, the clear policy. I think not. We don't have that yet.
We don't have that yet.
Yeah.
Mm.
But the server cost, the application cost, nowadays is really high lah. Actually.
So that will be a great challenge if you have developed any apps and you have to actually park it somewhere, maintain it, upgrade it continuously, right? Isn't it? So that have to be thought about before you start developing apps, happily and many apps around. But then, you will not last long enough, or you may not get it up long enough and get back the investment, isn't it? So is that a way to go about it to overcome this? So if any one of you have experience, then maybe you can share. Of course, if you not knowing anything now, it's okay. We would grow together, learn together. Hopefully it's not too long. We aim like 1 or 2 years time, so we get a very good answer. We get all the necessary answers to all the critical questions. Of course, we'll keep getting answer for whatever eventual rising technological questions or digital health. Yeah, then we will go from there. Yeah. Right. Is there any comments? Otherwise, I think we shall stop. We will not stay here forever. But keep. I think we will have a link for you to join. To express your your willingness or your intention to join this group, and we'll see how big is the group and how keen are the members. Then we'll actually put this create a group. Of course, the group's members will be from the CRU and the Faculty of Science, Computer and Technology, Maklumat, UPM. We open to everyone from Malaysia, as well as from China. I can see as my PhD students. Also from anywhere, yeah. So long we can, kind of help each other, share resources, especially the brains, and share contacts and get to a clear map how to go about these digitalizations of healthcare, perhaps also for our life, or even any institutions that you are working in. I'm talking a lot. Any other comments or sharing?
Hi, Dr. Chiu.
Yeah, who is that?
Sorry, Farida here.
Farida from?
I'm not sure whether I missed this because I'm on and off. In Malaysia, do we have like a clinical the good practice guideline that about this digital health? I'm not sure KKM have it or the MOSTI or the any agency that have the clear pathway of doing this. It's quite hard for us to start from scratch. Yeah, I have that feeling now. The budget is the real issue. Everything kalau no money, no talk, think every time. So at least if can have like the national punya policy ke apa?
I have very little knowledge, but we do actually have done some search around. If you remember, this one of the slide in Dr. Sam's talk. There's no clear regulatory or legislative definition for digital health. Even worse when you come to this AI, VR, that kind of thing. But we are not like left without anything at all. Later I may just share some link. We do have some like would say MC guideline on teleconsultations because due to the pandemic, right? So the MC or MCMC has come up with some some so-called guideline, but I think it was quite a kind of hastily done lah. So I'm not so sure how extensive it is. So you're right. I think it's good to actually start on from there somewhere. We came across some article as well, kind of elaborating on the Malaysians landscape of digital health. Again, they are very general. So this initiative is to collect experience, and we are moving on to actually mapping it. What is the best way forward lah? So you are right. There are actually some government agency, which I remember KKM do have this digital health unit, that kind of thing, and UM is also or has been established their e-health unit as well. So if you Google e-health UM, you can see they have done something. That's why, and I heard UKM also, they got expert in digital health, in AI, that kind of thing. So we hope, all these are people who have done something like experience and expert somewhere and here and there in Malaysia, right? What is the most reasonable and logical way of going forward, but not, come together and share experience, isn't it? So we hope also to get somebody from KKM or UKM or UM to join, to come together in this group. I don't think anyone would mind to share your experience, expertise, isn't it? To make us those who want to embark on this journey. And you would actually share also whatever that we come up later in this 1 or 2 years, as all the answers to all the difficult questions. We also plan to conduct a systematic review to gather all these potential barriers and facilitators.
Okay, just one more thing that I'm thinking of, whether the industry, public and industry relationship in developing this. I just dump my thoughts lah.
Sure, go ahead. Come.
Just because I'm sure with digitalization of economy and things like that, there are a lot of startup out there. But I'm not sure whether how we can. I'm sure we can work something with them, but it just I just don't have any idea. I just thinking whether how open we are to the public in industry co-ownership or something like that.
Yeah, that's very tricky, isn't it? To have all these so-called sharing of resources, but then people who actually want to guard their
patent and code and things like that lah. It's all money right nowadays.
Yeah, intellectual property, all that, right? They have invested. Now you want to just share like that, all that, isn't it? So you'll find a way to get them involved. So do actually stay with us. Share with us your idea. If you dream about some good thought, just share with us. We will share a place, a way that you can keep in touch with us on this thing. I was told my staff have prepared some evaluation form, and within it there's a link for you to join a group, something like that. Okay. Before I pass to them, I'm sharing you with you an article, on the chat box, about an article written on the landscape of an overview of the digital health landscape in Malaysia. There is also one very good articles by a law firm on how digital health in Malaysia has progresses, and what likely kind of issues that we may face if we want to think about in terms of regulatory this on digital health and applications on that.
Okay. I will
Okay.
leave it. Yeah.
So we are still very, very young. I mean, we hope we will learn from others and others will not mind to teach us and share with us their experience. So I'm not so sure whether how many here are from non-UPM staff or from KKM. If you are from some JKM or you have affiliated with KKM, share with them that about this group, this initiative, that we invite them to join us to kind of be our friends and compatriots, to on this journey. Which I think if we come up with something, we are going to share with everyone as well. Thank you, Farida.
Sure, my pleasure.
I think that's about all from the audience, Iman. Do you have the link? Share with them so they can share with their colleague.
Is it the attendance link, Prof?
Is attendant links inside there? They can, is there some informations about us that they can keep in touch with us and we can actually contact them for
because
further grouping?
because in the attendance thing, we will collect their information like
Okay.
their emails and also phone number.
Okay, sure. So do leave your email and contact in the form. So we will actually contact you. I mean, invite you for the groups. Right. Okay. So I conclude the sessions.
Okay, thank you, Prof. Chu, and thank you everyone for your participation. So you can, before you leave the session, do not forget to fill in your attendance and then leave your contact for our next series of Digital Health Initiative webinar. Thank you and see you again.
Bye.
Thank you.